the active surveillance for low-risk prostate cancer continues to rise. Until about 10 years ago, most men diagnosed with prostate cancer that has a low risk of causing death had immediate treatment with surgery or radiation. Although both are considered to be cures for low-risk prostate cancer, they can also have serious and lifelong side effects, including urinary problems and erectile dysfunction. But a recent study confirms findings from earlier studies that found men are increasingly opting against immediate treatment. Instead, they are working with their doctors to carefully monitor the cancer via a process known as active surveillance, holding off on treatment until there are signs of progression. Overall, the study, which included data from 240 urology practices across the country, found that about 60% of U.S. men diagnosed with low-risk prostate cancer are now being managed with active surveillance. In fact, the rates of active surveillance more than doubled between 2014 and 2021, the time period covered by the study. The finding is encouraging and shows that the use of active surveillance is headed in the right direction, said the study's lead investigator, Matt Cooperberg, MD, who reported the findings on May 15 at the American Urological Association's 2022 annual meeting. But they are still not where they need to be. Of particular concern, Dr. Cooperberg noted, is the finding that in some urology practices only a small percentage of patients with low-risk prostate cancer are on active surveillance. There were urologists in some practices who did not have a single patient with low-risk disease on active surveillance. Those findings fly in the face of recommendations from leading medical groups that say active surveillance is the preferred approach for men diagnosed with low-risk prostate cancer. Those doctors are doing their patients a disservice, said Howard Parnes, MD, Chief of the Prostate and Urologic Cancer Research Group in NCI's Division of Cancer Prevention, who was not involved in the study. If a patient meets the criteria for low-risk disease, active surveillance needs to be a central part of the conversation. Most prostate cancers diagnosed with PSA-based screening, which became widespread in the United States starting in the early 1990s, are low risk. Generally speaking, that means they are small, confined to the prostate, and not considered to be aggressive according to a common grading system known as the Gleason score. If you have been diagnosed with prostate cancer, work with a doctor who will work with you. Also, get as many second opinions as possible. Remember, doctors are not infallible.